Happy Friday, Bustmob. I am Greta Nance, and I'm so excited. It feels like it's been a while since we have done a surgeon live, and we have a really exciting one today with Dr. Rafi Fredman from Amelia, St. Louis, and we are going to grill him all the questions you guys have been asking in Bustmob about Preserve. Or, if you didn't even know how to say it, it's not preserve, it's preserve. And maybe he can even explain to us why it's called that. But it really is a groundbreaking new way to do breast augmentation, or really a truly a different surgery itself. So we're going to ask the man about it. But introduce yourself, Dr. Fredman, so we can hear about you.
Yeah, it's great to be here. It has been a while,
Hmm.
but it's great to be here. Yes, I'm Dr. Rafi Fredman. I'm a board certified plastic surgeon at Amelia Aesthetics in St. Louis, and I specialize in breast and body surgery. Breast augmentations is one of the most common surgeries that I do, and my practice over the last year and a half has changed. It's different than it used to be, really because of Preserve. So I'm excited to get to talk about it and explain to everybody really what it's about and what I've learned over the last year and a half doing it, and it's a really exciting thing.
Well, maybe we can get started that way because I feel like there's lots of ways we could deep dive on this, and we're going to, hopefully. But in simple terms, like what is Preserve and how does it differ from, say, a traditional breast augmentation?
Yeah. So Preserve refers to a certain technique of how a breast augmentation can be done. So it's still a breast augmentation with done with silicone implants. It's just a different technique, and that technique comes with some advantages for some people. And thinking like big picture, a traditional breast augmentation is a great surgery. It's a surgery that plastic surgeons have been doing for many decades. And it's a surgery that I still do all the time, traditional breast augmentation, whether over the muscle or under the muscle, subfascial. Those are great surgeries, predictable surgeries, and many people have those and have great results. So, why would you really need to take a great surgery and make it better if it's already great? And the thing is that Preserve is just a different way, different approach of doing a breast augmentation, which may be better for certain people. Why it may be better for certain people, we're going to get into a lot today. But really, at its like core and most basic, it's just a different technique, and that technique requires a certain set of tools. Those tools were made by the company that makes Motiva implants, Establishment Labs. So Preserve is made by Establishment Labs. Those tools are made by them. They're done with Motiva implants. It's all kind of connected, but it's really just a technique and different approach to breast augmentation.
I know, well, maybe you can tell us where the word preserve came from, because I know there's a piece of this that I keep hearing the surgeons talk about. One of the biggest advantages is preserving your own natural breast tissue. Like
Yeah.
what are the advantages to preserving your natural breast tissue versus the other way?
Yeah. So, a traditional breast augmentation, the concept of it, the basic concept is you have to make a space for the implant, right? You're going to put an implant
Mhm.
in, again, whether it's over the muscle or under the muscle, you got to make a space for it. And how do you make the space? You make the space by going in and cutting open the space, really. If it's under the muscle, you create a space under the muscle. You have to cut a little bit of the muscle, divide some things to make room for the implant. And if it's over the muscle, whether it's subglandular or subfascial, you have to cut open a space to make that space. Now, when you do that, a reasonable question is when you cut things, um, are you potentially, is there any effect to that? Like, is there any downside to cutting a space where the implant's going to be? And the answer is there may be in certain situations in some people. So, going back to kind of anatomy, one of the really exciting things for me as a surgeon learning about Preserve has been understanding breast anatomy in a little bit of a different way. So the shape of the breast is created by a ligament, just like you have ligaments throughout your body, knee, arm, things like that. Your breast also actually has a ligament. It's called a circummammary ligament, which just means it's like the ligament that goes around the breast. That's what creates the shape of the breast. And it's actually a ligament. It's these like fibers that run around the border of it. When you do a traditional breast augmentation, you have to disrupt a lot of that ligament to make space for the implant. That's just that's how you do it. When you do that, just like thinking about any like ligament that gets injured or damaged, right? Ligaments give support. Again, think about like your knee. You potentially destabilize things. So if someone injures their ACL, they destabilize their knee. So if you do some damage, even if intentional in surgery, to the breast ligament, you destabilize the breast a little bit. And if you then put an implant in, it's I think a good thing to think about: what is the long-term result of having an implant in a space where you've caused some destabilization? One of the things that can happen to an implant in a traditional breast augmentation over time is it can move around. It could drop down too low. It can move off to the side. It cannot stay where you necessarily want it to. There's a lot of talk now about supportive breast implants, and we may get into talking about mesh and things like that in the future. But that's kind of the idea: is could you do a breast augmentation and not destabilize the breast at all? Could you preserve that ligament? That's like the main thing. Could you do a breast augmentation and preserve the ligament? And until Motiva created these tools, there really was no way to do that, because how are you going to make a space for the implant without cutting through some of the ligament to get in there and do it? That's kind of the key and the magic behind it, is that if you have a set of tools that are designed specifically for this purpose, to go in and make a space for the implant, and we call that space like a nest, and that's what the preservative devices do. You haven't cut through the ligament at all. You've preserved all of that support. And then if you can put the implant in surrounded by that really healthy supportive breast tissue, that can give a lot of long-term support to the implant. That's the concept behind it. Now, the really exciting sort of side effects of it is, because all of that is a lot less invasive than a traditional breast augmentation, then also we can talk about, you don't have to be asleep for it. You could do it awake. The recovery isn't. So those are almost like the side effect benefits of it. But the core of it is really like a technical thing, which is doing a breast augmentation while still preserving all of those natural structures.
So potentially longevity might be your biggest advantage. Secondary, maybe recovery. But do they look different? You know what I mean? If somebody had a 1 month out Preservé augmentation and a 1 month out traditional, is there any advantage in the way they appear, or is it mainly in longevity and recovery?
Yeah, the process of getting to a final result is definitely different, but it's different with different techniques. It's different under the muscle compared to over the muscle. Like that's different. Under the muscle, they're really, the Franken movement, it takes a lot longer for them to settle. Over the muscle, it's quicker. And Preservé also is different. So I've learned in doing these over the past year and a half what that process looks like, and I coach patients through that. Like initially, part of the idea is that the pocket, the space where the implant is, it's made intentionally a little bit tighter than it will end up being, because we know everything's going to relax a little bit over time. When you take an implant and you squeeze it, it projects more. It doesn't have its like full form that it's going to have. So it does take time for that to happen, but it does happen pretty quickly. Like usually we're talking like Preservé results in a week look amazing, and they look closer to a final result than other approaches. So I have seen that it is a quicker path to a certain result. That being said, I always tell people, like, the goal is your final result. The goal is what you look like at 6 months and a year and 5 years and 10 years. So it's all about longevity and giving the best long-term results. Can Preservé give a better long-term result than a traditional breast aug? That's a hard thing to say, because traditional breast aug gives great results. So it's hard to say that you can get better than a great result. I think, ask me in 10 years if I think that certain people have different or better results in one technique over another. From everything I've seen before, it gives beautiful results. Again, not necessarily better, but it may be better for certain people because of kind of how you get to that result.
Yeah. You made me think of, maybe because this gets asked in Bustmob a lot too, about the rules around Preservé. Okay, well, it can only be put over the muscle. So you reminded me, like, that's another huge advantage to people who want to go over the muscle but are worried about capsular contracture. So maybe we can talk about that. But also the size. there is, I mean, it's just even imagining a smaller implant, in its nest does seem like it's going to last higher, stay higher longer than a 600 cc implant, put over the muscle. So yeah, there are some rules when it comes to Preserve.
For sure, yeah. And those rules probably will evolve over time as surgeons learn more things about it, as different things change. But currently, there are certain limits. So
Mm-hmm.
one of those is the size of the implant. So like the largest you can go with Preserve is a 315 cc implant, and even within each profile, there's limits. So like the largest mini you can do is a 220, the largest demi profile you can do is a 265, and the largest full is a 315. So it's not that uncommon that I'm in conversations with people. I'll say, you're interested in Preserve, you otherwise would be a good candidate for it, but I think you are going to want a, 450 to get you to your results. So this is not the right technique for you.
Mm-hmm.
Similarly, Preserve is done with Motiva ergonomics implant, which is one of their two
Mm-hmm.
types of implants. Motiva also makes the Motiva Round, which is for a more augmented look. So depending on a person's goals, that may also shift things. So Preserve is for a certain size. It's only for an ergo implant. There's some, other situations where someone may not be a good candidate for it, but those are the general kind of rules around it. But it is over the muscle. It's always
Mm-hmm.
done over the muscle, preserves the muscle and all that, which is appealing for a lot of people.
And talk to me about capsular contracture with
Yeah.
Motiva
Okay.
implants over the muscle.
Yeah. So this is talked about a lot because, in the past, uh, surgeons and myself included would caution sometimes against over the muscle because there's research that shows that over the muscle compared to under the muscle has a lower capsular contracture rate, over the muscle has higher, and that's been shown in research studies. There's questions about subfascial. That's a kind of controversial topic as far as whether subfascial, which is a form of over the muscle, you take that thin layer that sits on top of the muscle and put that over the implant, could that reduce the risk of capsular contracture? Some surgeons believe, yes. We don't have great data on it. And then Motiva came around. So one of the goals of Motiva when they set out to create, or Establishment Labs when they set out to create the Motiva implants, was to address some of the problems that implants have. And one of the problems is capsular contracture. We know that capsular contracture is an inflammatory process. It has to do with how the body interacts with the implant. So they set out to make an implant that created less inflammation in the body. And they created a certain type of surface called a smooth silk surface that is actually the least inflammatory implant that exists.
Hmm.
And no surprise, if you understand the basic science of it, that it also has the lowest risk of capsular contracture, whether under the muscle or over the muscle. So these implants are really designed to be able to be placed over the muscle, and that lowest capsular contracture rate has been consistent and over the muscle, consistent in Preserve in recent research that's been shown. So that holds true. So from a capsular contracture risk, that isn't something you have to worry about because of more of the nature of the implants themselves.
Mm-hmm. That's huge. Like
It
whether
is.
someone's doing Preserve or not, are you offering Motiva implants over the muscle more because
Yeah,
of
my
that?
practice has shifted. It's about 50-50, I would say. But the
Uh-huh.
conversations, and the most like exciting part for me is that the conversations are less difficult than they used to be. Like I used to have more conversations with people where I said, I get that you want to go over the muscle, but you have to know about this high rate of capsular contracture. So these are the things we could do. We talk about textured, and that came with, its own issues and
Mm-hmm.
things, and they're just like weren't great options. It's a lot nicer now to be able to say, yeah, we can go over the muscle. There's the pros and cons either way are a lot more subtle, and we can really dive into for each specific person which one's really going to be best. But it is shifting across the U.S. I can tell also in my practice, moving more towards over the muscle. Yet there still are a lot of people that go under the muscle, and that's a great
Mm-hmm.
place to put implants too.
Yeah, this makes me so happy because capsular contracture, I think, is like the biggest risk, right, for some sort of reoperation. Wouldn't you say that's like the
Yeah,
highest?
I think it's well, it's not necessarily the highest reason that, at least in my practice, that somebody has a surgery after
Mm-hmm.
getting implants, but it's kind of the most annoying one for a person to have to have. I would
Hmm.
say, because like
Hmm.
the surgery to treat capsular contracture, it's a pretty big surgery. Like for some people, it's bigger. You got to go in, you got to take out scar tissue, and it's more involved. And sometimes you're switching from under the muscle to over the muscle, and it's other things, whether it's an implant exchange or doing some pocket work. Those are in some ways sometimes a little more minor. So um,
Hmm.
any way that a surgeon can lower the risk of capsular contracture is good. And there's a lot of things. I mean, there's many steps in any breast augmentation that are done to lower the risk of capsular contracture.
Well, personally, I have been affected by Capcom, so I am so excited to be able to tell people. Unfortunately, I already have an augmentation, so if you already have an augmentation, as far as I understand, it'd kind of be pointless to investigate Preserve for an implant exchange, and maybe you can answer that. But I am so confident now in getting my Motivas over the muscle that hopefully I won't run into any Capcom issues again. But yeah, who is this for and not for?
Yeah, and that's probably that question is one of the most important things because I spend in consultations probably an equal amount of time signing people up for Preserve as talking people out of Preserve now, because a lot of people are coming in saying, I want Preserve, but
Yep.
there's a lot of nuance to who it's the right person for. So,
Hmm.
so yeah, let's talk about first kind of who it's right for, and then we can talk about like who it's not. And just to even jump to what you mentioned before, in its most basic sense, Preserve is for somebody getting implants for the first time. It really, the concepts of it don't apply when someone already has an implant and you're just swapping it out for a different implant, um, because that capsule is already there. So you're not going to need to
Hmm.
use those tools to create a space for the implant because it's already there. So it's just
Hmm.
not really applicable. Um, Preserve is great for somebody that wants a breast augmentation. We usually say an increase in cup size of 1 to 2 cup sizes, but I'm always careful with cup sizes because you go to stores and they measure people differently. But we call it kind of a subtle boost, whether it's really subtle to a little more augmented. Because the 315, if you look at the before and afters in Preserve of 315, like that's a definitely a noticeable change and a lot of
Hmm.
upper fullness up there. So you can get a lot even still with Preserve. It is a lot of who it's great for is it's a combination of a person's anatomy. That's one factor that could make someone a good candidate or not a good candidate. And then the other part, which is just as important, is the person's like life and how it's going to fit into their life.
Hmm.
So I take both those things into account. So from an anatomy standpoint, it's great for a person without super complicated anatomy, I would say. Like, someone with relatively straightforward, relatively kind of normal anatomy. There can be some asymmetries from side to side. Everybody has some. There can be different sizes and things. Um, but if someone has really complicated anatomy, it might not be the right tool. It is great for somebody that wants an implant over the muscle. And we can talk about a lift because you can do Preserve with a lift also. So just
Hmm.
needing a lift doesn't mean that you're not going to be a good candidate for it. It's not necessarily the best tool in somebody who has really poor tissue quality, because if the whole basis of the technique has to do with preserving the person's own tissue and ligaments and support, if those ligaments and support aren't going to be able to do their job, we shouldn't rely on them.
Hmm.
So in people that have had a lot of weight loss, like significant weight loss, I mean, a lot of people have had weight loss, but significant weight loss and their tissue quality is really poor, those ligaments have been stretched and they've gone back. And to think that those ligaments are going to do everything we need to support the implant, probably not a great idea. That's when we then talk about maybe it's going to be better to talk about adding support because we can't rely on their
Hmm.
own tissues. And we talk about a mesh internal bra. And then you're not doing Preserve because you don't do Preserve with mesh.
Got it.
It's either Preserve or breast augmentation with or without mesh. Um, so again, someone should have good tissue quality.
Hmm.
For putting an implant over the muscle, we want to be thoughtful about how much coverage, we call it. That's like the surgeon term for how much tissue is on top of the implant. Because even in Preserve, if somebody is super, super, super thin and there's just barely any tissue on top of the implant, we worry about, are you going to notice some rippling? Because even though Motiva implants are ripple less than traditional
Hmm.
gummy bear implants, any soft implant's going to have some rippling. Like I'll show people, this is an ergo implant. And,
Hmm.
if you hold this implant and I didn't bring a traditional gummy bear implant, next to a regular gummy bear implant, you can tell this one is rippling less. For sure, it ripples less. But any implant, like if I show it, you can see there are some
Hmm.
creases there, because the only way to not have any, it would have to be like rock hard.
Hmm.
So if somebody's super, super, super thin, you might see some of that. And I'll talk to patients about it if they're interested in Preserve. One of the tricks is if you can see like every rib on a person's chest, think about it, like your ribs are under your muscle. So if you can see
Hmm.
all your ribs, what's going to stop you from noticing, some of those ridges and things like that? And then
Hmm.
it'll be a conversation. I have some patients that'll say, okay, I am okay if there's a little rippling in certain
Hmm.
positions. It's not really not going to bother me, but this is the only way I'm getting implants. And then we do it anyways. And
Hmm.
there's some ways that we can, mask the rippling and things. And then some people will say, you know what, it's going to be better to go under the muscle.
Hmm. Do
Um,
you, oh, go ahead.
no, I was to say, and then a huge part of it is uh, fitting this into a person's life. So, like, one of the most exciting things about Preserve has been that people are coming to me and saying, I never would have done this, or I was always excited to do it, or interested in doing it, but I never wanted to go under anesthesia, or I couldn't take any time off. I'm super active. I have little kids. I can't be down at all. I have a physical job. Like, they'll say all those things, and they'll say like, "This is just perfect for you." Like, so how it fits into a person's life. I'll never remember one of the first one of the first consults I had when I first learned the technique. So before anybody really knew about Preserve here in the U.S., this person came in for a consult for a traditional breast dog, and she was in the military, and she was like, I have to be able to do push-ups at a week. Like I can't do this if I can't do push-ups at a week. And her goals were consistent with what you can get with Preserve. And I was like, I got to tell you about this thing because it literally is perfect for you. Um, so what it does in terms of being able to fit into people's lives and provides a solution that didn't exist before is, I think, one of the most exciting parts of it. So when you combine all those things together, that's what makes a great candidate. It's like you have to have the right anatomy and you have to be the right person, and want the things that Preserve will give you. And if those two things combine, which as I've seen over the past year and a half, there's a lot of people. There's a lot of people out there that almost every Preserve person has said, like, I don't think I would have done this if it weren't for Preserve.
Yeah.
And that's
It,
amazing because then it's more people that get to benefit from having implants.
well, it's so nice. We try to share stories, obviously, in Bustmob and Amelia to make people see what the process is really going to be like. But it's hard to capture people right out of anesthesia. Most of the time it doesn't look that great. But you have been able to get all of these really cool, even on the table, people talking about how it feels. I feel like that was easily a year ago when you were so excited telling me about this for the first time. Maybe it was longer than that.
Yeah.
But I think you were even talking about, well, maybe I'll still offer anesthesia at first, but can you tell me, since you've done so many now, like how the operation seems to go for people? And, are people nervous about it? Do you give them anything? Do they drive
Sure.
themselves home? Yeah, what's it like?
Yeah. So it's kind of evolved over the past year. So when a surgeon is first learning how to do Preserve and
Mhm.
first doing it, and I train other surgeons on how to do Preserve, so I'll tell them when you first start doing it, you should do it with anesthesia because it's just you want to have full control of everything. It's what you're used to. You don't want to change too many variables. That's like the best approach to have initially, and that's great. And people still do really well. As the surgeon gets more comfortable with it, then you don't need to have as much anesthesia because of the way that you numb everything up. The person doesn't need to be as sleepy for it. Um, and as I did more and more, I quickly realized like people are really comfortable with this. The process of um, being able to do this in someone with less anesthesia or no anesthesia, which now is like 98, 99% of the preservations that I do, people are
Wow.
totally awake. So the process is you come in and we go over everything before and all that. And some people are more nervous, and we can give somebody a Xanax before, so they are just feeling a little bit relaxed. But even without it, people do really well. And we go back, and the first step of it is numbing everything up. So I'm a surgeon. I'm biased. I like doing surgery. generally on people that are asleep. That's what I've done for a very long time, and that's what I'm used to. So why would I be interested in doing this on people awake? There's some procedures that I do with numbing medicine on people that are awake, and I'm very aware and in tune with what people are able to tolerate well and what they're not comfortable with. And if there's something that people are not comfortable going through, then we do it with sedation or asleep, because again, I have no interest in making people uncomfortable. But if someone can go through a procedure and be really comfortable, like honestly comfortable being awake, then it is an option. And again, of course, if you can do the surgery, with that, like you're not going to do a tummy tuck on somebody awake because you can't do the surgery. But as I learned how to numb everything up, and that's really the key to it, is doing the numbing in a way that is not uncomfortable for people. And it's amazing how well people do. Every single person has said it is easier than filler. It is easier than tattoos. It's easier than going to the dentist. And I'll tell people, like, if you're okay with all those, you're going to be totally fine.
Mm-hmm.
There's like a little pinch when I just start the numbing medicine. That's like the smallest little, it's even less than a shot, but people don't flinch when I do it. So I don't think it's very painful.
Mm-hmm.
And then after that, everything else gets numbed up. And then the most that a person feels during it is when I inflate the balloon to create this space for the implant. So this is the
Oh,
Preservé
perfect.
balloon, as people have probably seen. And this goes in through a little incision, and the same incision, but it's small in the crease under the breast.
Mm-hmm.
And then this gets inflated, and that creates the space where the implant's going to be. When that balloon gets inflated, most people will say it feels tight, and then I'll say, does it hurt though? Are you having any pain? And they'll say,
Mm-hmm.
no, just tight.
Mm-hmm.
And then I'll say, okay, well, it's just temporary. I take the balloon out, and that's it. It's like a few seconds of a balloon, and then the implant goes in. We give people little headphones, they listen to their music, a little eye mask, and they just kind of zone out. Or if they want to talk, my team is incredible and is
Mm-hmm.
great with talking to people and all that. The whole procedure doesn't take very long. I mean, it doesn't take more than 30 minutes usually.
Wow.
And then they hang out for a little bit, and then they walk out of here like it's nothing and go to dinner or do whatever they want. It's
Yeah.
unbelievable.
What about restriction? I mean, it's so mind blowing to me
It
because I've
is.
seen this
Yeah.
done the other way for 23
Yeah.
years. But like, can they drive home? Can they not lift things?
Yeah.
Submersion in water? What are the rules?
Yeah. So because the surgery is done, can be done without anesthesia, and it's usually done without anesthesia, the rules are different. So one aspect is travel. So that's actually a way that my
Mm-hmm.
practice has changed over the past year and a half. So we have a lot of people travel here for surgery in general. And people are traveling here for Preservé. Not needing anesthesia changes some restrictions. So like you don't have to fast before, so that helps. And because you don't need anesthesia, you don't have to stay overnight, because when people need anesthesia, they have to stay overnight and be watched and
Wow,
things like that. So we have people that are flying in, having their Preservé, and flying home the same day. That is unbelievable. Like
that's
people
amazing.
flying from California, have their procedure, fly back, be home in their bed that same night. So it just opens up to a lot more people that are able to travel here, which is wonderful. Um,
So
and
cool.
then just in terms of fitting into people's lives, the restrictions are a lot less. The reason the restrictions are a lot less, one is the anesthesia part, but that only
Hmm.
applies to the first day or so. But also the restrictions that we put a person in terms of activity is less, because things aren't cut during the surgery. We don't have to be worried about causing bleeding or causing other issues by doing a lot of lifting and things like that. The first period kind of lasts for a week, where we tell people for a week, just kind of take it easy in terms of really heavy lifting. So don't go to the gym for a week. You can pick up your kids, but like try not to lift like super heavy things for that first week.
Hmm.
And people are fine with that, because usually, a little bit sore in the first few days. But by a week, you can go back to the gym. You can lift things. You can do just about anything you want. The only restrictions that I tell people is not like, don't go back to the gym and start bench pressing and pushing yourself. Don't do like CrossFit and just go crazy with stuff. But you can do push-ups. You can do lighter weights, just kind of easing into things. Pilates, yoga, all that is fine in a week. And that's different than a traditional breast aug. Because the incision's smaller, we let people swim a little bit sooner too, so they can swim at 4 weeks instead of 6 weeks. But a lot of that is really important for people. I have a lot of patients that are like, I can't do this if I have to take 6 weeks off.
Hmm.
from full exercise, or their work doesn't allow it. So that really opens things up for a lot of people, and a lot of people with little kids too that are like, I got to be able to like run around and chase them and pick them up and do all the things that I do as a busy mom, and I can't have any downtime. And you
Hmm.
literally have no downtime with this.
It's amazing. And it's so fun to talk about, and we get all these questions all the time too. And I would ask you, since you're now training even other surgeons in how to do Preservé, do you see this being like the way everybody does breast augmentation going forward? Like, or are they going to come out with another version of this? Or what do you see the landscape, at least in the States, looking like for breast
Yeah,
aug?
so it will not and should not become the way that people are doing breast augmentation across the country. And the reason why is because it's not for everyone. Like I kind of mentioned before, a few situations, but there will always be a role for traditional breast augmentation, because this is not the right technique for everyone because of their people's goals. Many people have goals that aren't going to fit within what Preservé allows, and also for technical anatomy reasons. Like there are people, will always be people that it's not the best technique for. But what I already see it doing, which is really wonderful, is it's just opening up breast augmentation to more people. So I think when we look back years from now, there'll be some people that would have gotten a traditional breast augmentation, instead they get Preservé and are very happy. But I think more than that, we're going to see that the people getting a traditional breast augmentation are still there getting their traditional breast augmentation, but now there's a whole new group of people that are now getting implants because it's now something that they can fit into their life and that they want to do. That's what I've seen over the last year and a half, and it's been really, really exciting.
Oh, that's cool. Is there anything if a Bustmob member is looking to have a consultation for Preservé, like do's and don'ts of surgeons to look for or not? Or I know at first you had to be a board certified plastic surgeon to do this. Can you give some suggestions for finding a Preservé surgeon that maybe has
Yeah,
done it a number of times?
yeah. I mean, in general, you should only go to a board certified plastic surgeon just for most important basic safety reasons and standard of care. But anyone doing Motiva, at least for now, Motiva only gives implants to board certified plastic surgeons or board eligible plastic surgeons. So
Mm-hmm.
so as long as they do Motiva implants. Um, and then it's true, in terms of Preservé, it's really not much different than I think if someone were to say, or if you were to have asked, like, well, if I want subfascial, how do I know who to go to? I
Mm-hmm.
think it's always about finding the practice that you feel the best connection with, and the surgeon that you feel the most connected to. And I encourage people always to get multiple consultations, because you'll see people have different styles and different approaches. And you may see one surgeon and they say, oh, you shouldn't do Preservé. And you may see another surgeon, they say, you're a great candidate for it. And then you see a third, and but you'll eventually find your kind of home and your place. And I think the same approach is here. Is if a surgeon does Preservé and they do it with anesthesia asleep, but that's what works best for them, and that's where you feel connected to the most, then that's what you should do. Um, so I think it's more about finding where you really feel like you're the right fit.
Okay, perfect. I had a couple questions, and I think that you have created some content about this or answered questions like this too about size. Since size is always probably the biggest conversation in the bus mob community, even sometimes, does under the muscle take away 20 cc's in appearance? I've been hearing like the opposite for Preservé. Like a
Yeah.
smaller implant actually looks bigger than it is and or can give you fullness in like a different part if you're a little saggy maybe. Is that
Yeah.
true?
Yeah, so those things I do believe are true, that I have seen to be true. So the ideas and the reasons why. So I tell patients that with Preservé, you can get a smaller implant and get the look of a bigger implant with a traditional breast aug. And that's great, because if you can get the look of a 350 with a 265, smaller implants, there's less risk if you're smaller implants, and it's just kind of easier, in
Mm-hmm.
general, recovery and things like that. So why do you need a bigger implant? Um, why is that? So it's not like some magic that it's looking bigger, and it's also not like in a traditional breast aug tissues being removed. So why
Mm-hmm.
should Preservé look bigger? A lot of it has to do with implant placement, as I've learned, and the idea with Preservé. So if you see any video of anything, how I mark people before the surgery. So the idea with Preserve is um, we're able to pick where we want that implant to live, where we want the that nest of the implant to be. And I literally draw on the person before where that's going to be. So we draw, I have a special stencil that I basically map out where the ligament is, draw on each side where we want that implant to be. And then we go in to do the procedure. And during it, because that space is going to be made with this balloon, I'm able to deploy this balloon precisely where we want that implant to be, which can be higher on some people if that's the right place for it to be. And what's going to keep it up there? The ligament, everything that you've done. So one of the first things as I was doing Preserve that I was amazed by was, wow, these implants are higher. Like they're definitely placed higher than a traditional breast aug. That implant is not sitting right at the lower part of the breast. It is higher. That I believe is why you can get a bigger look with a smaller implant, because it's being placed, more up and in where the person actually wants the fullness. And the idea of it is we're actually thinking of the breast as kind of a whole where many people have some of their own breast tissue, some people just a little, some people more, but a lot of people are lacking fullness where they want it, kind of in the cleavage area and the upper inner part. So if we can add an implant there and then allow the person's own breast tissue to fill the rest of the space and everything blend together really well, and that's kind of the key of it, it's to all blend together as one unit. You don't want to have like implant and then breast tissue. Then you can get the look that you want with a smaller implant. It's almost like thinking of breast augmentation as like a filler almost, that you're just going to fill the area, but it's doing it in a really controlled, really precise setting. And all of that it's the implant, it's the techniques, it's like all these things combined.
Wow. You mentioned lifts, and it does sound like for some people, a lift with Preserve might be an option. Because I want to talk about costs at some point too. So
Yeah.
that may be a piece of thinking through whether whether you want to do this or not. But tell me how a lift works with Preserve.
Yeah, so lift can be done with Preserve.
Okay.
And the lift and Preserves that I've done have been amazing. I mean, they look incredible. You get a lot of benefits of the Preserve and plus a lift. So when is somebody a candidate for it? Because one of the things that I've learned with Preserve that's really neat is it can take some people that are what I would put in the category of like borderline lift, people that previously we would have said, no, you definitely need a lift for. And it can actually give them the result that they want without a lift. There's some technical reasons why, but there definitely are people that we're not doing lifts on because Preserve can give them the results they want without it. So that's pretty cool. But a lot of people, especially after pregnancy, breastfeeding, tissue hangs lower, nipple positions lower, still need a lift to give them the perky result that they want. You can do Preserve and you can also do a lift. Now, that conversation is a little bit more technical and nuanced because people will say, okay, so, and I can see people thinking as I talk to them about it, where they'll be like, all right, so I need a lift, I get that. So why should I do Preserve? Because like now I need to be asleep for it, and my restrictions afterwards are going to be limited in the sense that like you're not going to let me go to the gym in a week because I have to protect my lift incisions. So like, should I just do a regular breast aug? And I'll say, maybe, like you can definitely do a regular breast aug because a regular breast aug, even over the muscle, is great. It's a great surgery. You're going to have a great result. You're going to have an easy recovery. We do rapid recovery. Like it's going to be great. So who are the people that still got Preserve and why is it potentially, beneficial? That part really is technical. And I think that similar to what I was saying before, you'll have to ask me in 10 years of the people that got Preserve in a lift and the people that got traditional breast aug in a lift, how did the results turn out over 10 years? I don't think any surgeon in the world knows that answer yet. But what I can tell you from doing these is that when you do Preserve in a lift, you are still preserving tissue. I can literally see with my own eyes the implant in this space up here, surrounded by really healthy supportive ligaments. And that implant is higher up than a traditional breast aug. It has all this good tissue around it. And then I do a lift around it. So I can definitely say that is a great technique. Is it going to be better than a traditional breast aug? I don't think anybody knows. And that's what I tell patients. And then I leave it to them to decide. If they were to say, I agree with you, I love that idea, and I want to do it, then we do it. And then if they, if they're like, well, given that, let's just do a regular breast aug, then that's great too. And then they do great also.
Yeah, it seems you've got me sold. It seems like, of course, it would stay up there higher longer, you know? And I honestly like the filler analogy versus, say, an implant. I'm even
Yeah,
thinking through like cheeks, or honestly, I was thinking about butt. I was like, okay, fat grafting, you're putting things in through tiny incisions and making it bigger versus a butt implant where you have a big incision and a whole thing in there.
yeah.
Of course, one's going to hold up higher.
Yeah, and well, and those concepts also aren't even new. I mean, fat transfer for breast augmentation is something
Hmm.
that it has downsides. So it's at least in my practice
Hmm.
not so common, but it's been done for a long time. Injecting filler into the breast not a good idea.
Hmm.
It can cause a lot of issues. But if you could create something that you have control over everything, over
Hmm.
where it is, the structure, the shape, and you can just like push it into where you want it to be, well, that
Hmm.
is a really good idea. But the problem is implants couldn't do that. They weren't made to be able to go through these small little tunnels and get to where you want it to be. And even if they did, they wouldn't feel natural based on just how they're designed. So all of that is why this started with Motiva implants, because they had to first make an implant that could do those things. And this is actually just kind of the first iteration of it. So outside the US, they're already doing what's called a MIA procedure. And the MIA
Hmm.
procedure is done through a little incision in the armpit, which is a whole different, thing to talk about, which
Uh-huh.
I haven't done because it's not available in the US yet, because it relies on a different type of implant
Hmm.
that can even be pushed through even a smaller, longer channel to get a further distance. That implant is not yet FDA approved in the US. So it'll be, probably a matter of years before we have that here. But there are future iterations of it, but the concepts are the
Wow.
same as Preservé.
That's amazing.
Yeah, it is.
Um, And let's talk about cost. Because I do think, I mean, for anybody who does not already have implants and they're considering breast augmentation, I can't imagine them hearing all of this and being like, oh, that doesn't sound great. Sounds great
Mm-hmm.
in my mind. Unless cost is your number one concern.
Sure.
Because I do know this involves obviously not only these very specific implants, but using these specific tools um, that you have to use. Can you kind of compare what those costs would look like, or what should people be expecting? I don't know if it's different around the country. I'm sure it varies a little bit, but
Yeah, it definitely varies across the country. The general trend, even worldwide, is that it is more expensive than a traditional breast
Mhm.
augmentation, and it should be more expensive because the tools that you need to use them are really expensive. So,
Mhm.
just to kind of make it make sense to people, when the person's having Preservé, the surgeon has to buy the implants and separately buy, we call it a Preservé kit. So it's
Mhm.
literally a kit. It's a few boxes that have all the
Mhm.
supplies in it that are made. So the cost of doing the surgery is just higher for that reason.
Mhm.
Um, and that's probably the main reason that across the world it's higher.
Mhm.
And then there's the side of it being a specialized technique that takes
Mhm.
hours and hours and a lot of experience to train. I've traveled to Costa Rica to learn how to do it, and I've spent
Mhm.
just I don't even know how many hundreds and hundreds and hundreds of hours studying it, learning it, talking to other surgeons, really understanding the nuance of it. Um, and then there's the side of the experience part. So like it's not going to be for everyone, but for the person that this is the right thing for their life, it may make sense to have a procedure that's more expensive. It's going to be able to fit into your life.
Mhm.
Um, and otherwise wouldn't. So I think it makes sense that it is, but the range of what it is definitely varies, just like anything does in plastic surgery.
Mhm. Absolutely. People have to decide, kind of rank. I usually tell people, like, what is the most important thing to you?
For sure.
Everybody's value is different. Is it that recovery? Now that I'm old and have had my implants for like 23 years, I'm like, I would not have cared about longevity when I was 25 years old. But now that I'm 48, I'm like, what could I do that will last longer? Because
Yeah.
I want these
But
always.
to that point, I do think like as a surgeon that does a lot of breast surgery and a lot of revision breast surgery, that's a big part of my
Hmm.
practice too. There's an aspect that like I do wish people understood more, which is if and of course this isn't possible. Let's say you could come into your consultation and I could show you, a, a, a magic ball that told you what your future looked like in terms of breast surgery and
Hmm.
what it would cost. And we could say, well, so here's some different options. We could do this. We could do an internal mesh bra, and that would reduce your total lifetime, cost maybe to this, or we could do Preserve. It's hard. Obviously, you don't know,
Yeah.
and nobody knows there's risk to anything. But I do think it's important to think as far as a lifetime kind of
Yeah.
investment, and maybe a more expensive procedure is going to be a better thing because over 10 to 15 years, I always tell people like the goal is that you have this surgery and that you're not having surgery every
Hmm.
10 years and doing things like that.
Hmm.
And for most people that get implants, they're not having additional surgeries and things like that.
Hmm.
But it's a conversation, and that's where we get into it when someone, let's say, has really poor tissue quality. We'll say like,
Hmm.
well, I technically can do this, but we're probably going to be doing another surgery in a few years.
Hmm.
So why don't we do the right thing at this stage to give you the best chance of the best long-term result?
Hmm. Yeah, I mean, everybody, that's the hope. My sister had hers first set 18 years old, and she just had them exchanged after 18 years. And like, that's a goal. But yeah, I've toyed around with going up and going down over the years, but I tell everybody, like, once you get them, you're going to love them so much, you're going to want to pay for whatever upkeep is necessary. So, I can't imagine ever getting to a point where I'm like, I don't want these anymore. So
Yeah, and
along the way, it's a lifetime.
yeah, and people will ask me, it made me think, people will ask, well, if I do Preserve and I at some point need to do like an exchange or something, do I like
Hmm?
lose the Preserve-ness of it,
Ooh, good question.
or something? And what I tell people is no, because like if you think about it, the Preserve is about making a space and preserving, those ligaments and things like
Mhm.
that. But then your body does what it always does with an implant, is it forms a capsule around the implant. It's a thin layer of scar tissue, and that's going to be what, where the implant lives. But once that capsule is there, I can go back in and make a teeny little incision in the capsule, take out
Hmm.
the implant, put in a new implant, do anything that I need to do. And I'm totally preserving everything that was there before.
Hmm.
It's not disrupting anything more. And that can even be done. It depends if more complex things need to be done, but a
Hmm.
simple exchange can be done also awake. So it isn't like,
That's great.
well, if I do this in the future, am I going to like lose that preserve part of it?
Hmm.
No. I mean, once that space is there, it's there.
That's a great question. And this may be a naive one. Um, if someone's, can you hear me? Sorry, my
Yes.
AirPods.
Yeah, very good.
If someone's under the muscle currently and they want to switch to over the muscle, do you kind of close that pocket and then recreate another one? Like, could they technically do Preserve and get the benefits or no?
Okay, so now you're starting to think like a innovative plastic surgeon, because what happens is give plastic surgeons a set of tools, and you immediately start to see innovation, because surgeons are a very innovative group of people, and what you just described, that thought has already started and been thought about and even and tried. And it gets to like, are there extensions of Preserve? And there's other versions of it. Like, what if somebody's already had a breast reduction? What if or somebody's already had a
Mm-hmm.
lift?
Mm-hmm.
What if somebody had implants and had implants removed? Like
Mm-hmm.
these types of questions, there are already surgeons, and myself included in some situations, that are starting to use it in different situations. But these are very like case by case specific situations. So from a technical standpoint, could you use those devices, the Preserve tools, to do certain things? Well,
Mm-hmm.
technically, you can do a lot of things. Should you? That's up for debate. And also, that's probably going to be something that each surgeon needs to figure out for themselves and decide,
Mm-hmm.
is this the right set of tools to achieve what I need to? And you're going to have some surgeons that say, no, why would you do that? That doesn't make any sense. And some surgeons that say, well, it can work and there's benefits to it. So definitely an area that over time we'll hear more about, of surgeons saying, well, I do Preserve and breast reduction. Ooh, that's interesting. What does that mean? And I think it's just part of the nature of plastic surgery.
Mm-hmm. God, that's really, really exciting. Okay, last question. What are the biggest misconceptions you hear? And I guess honestly, from patients, from staff, and from other surgeons about Preserve, this technique as a whole, because I know it's also anything new is controversial in some ways. But yeah, what are some mistruths that you hear about it?
Yeah, I think that the probably the first thing, and I think we've gone through a lot of this and kind of cleared a lot of it up,
Hmm.
is that Preserve you know, can be done for anyone in a situation. I mean, I have people that sometimes come in and they'll say, "Yeah, I'm here for Preserve, and I'm really excited to get my implants under the muscle." So, like, just understanding the basic concepts of
Yeah.
who it's for, who it's not for. I think probably the biggest misconception is that it's not for everyone, and it's also not like a magical solution that can do anything. Like, it's for the right person and the right situation and all that. Um, that's probably the biggest thing. But again, for the right person, it's an unbelievable thing. I did 3 Preserve cases yesterday after some other surgeries in the morning, and they're just incredible. Like, these people that traveled here from far away, and they come in. Some of them came in that day. Some came in the day before, hanging out in St. Louis a little bit, and we're talking to them throughout the surgery. They're laughing. They're talking to my team, and they just have this incredible experience. And as a surgeon, I can tell you one anecdote that I think is super exciting. So I do you know, different types of surgery, and for the most part, I don't get to experience the moment that people first see the change that they have because of plastic surgery. Like, you know, when a person has a tummy tuck and they first, you know, take their first shower and they take off their garment and they're like, "Oh my God, this is my waistline. Like, this is my stomach." Or, you know, somebody goes home after getting a breast dog and looks in the mirror, you know, takes a shower and things like that. So I don't get to be a part of that. Um, and when I first started doing this, and I did the Preserve, and afterwards, you know, they were awake and they sat up and they looked down, and I got to, you know, give them a high five and be there and hear all the excitement on the team. That's when I was like, this procedure is unbelievable. Like, just for me personally as a surgeon to get to be a part of that with a person, and then yeah, to be able to have a way for people to have all the benefits of getting implants, because it is an incredible thing for a person, what it does for a person's life, for confidence, just feeling better in clothes, in a bra, in a swimsuit. Like, those are the things we hear all the time. And for a person to be able to do that and it not interrupt and interfere their busy life, it's an incredible thing, because even the busy people, even the super active people, deserve to be able to have, you know, the surgery too if they want.
Absolutely. I love, well, okay, there's one more good question I want to answer. Megan just asked a quick question. I think because you mentioned travel. Um, and she was specifically like, well, when do I do like 3D imaging and my like pre-op appointment? If somebody is traveling to you, do they have to travel to you before, say, getting Preserve at least once, or how is that done?
You know, so we've really dialed in and we have a really streamlined process for travel because a lot of people are doing it. So everything can actually be done virtually. And I would not allow everything to be done virtually if it didn't give people the exact same and the exact high level of experience as if they were here. So because of that, you know, we invested in we brought on a certain type of 3D imaging software that allows people to capture their own pictures at home. Because before we were using the vector camera that you have to be in office. So we can actually have people take pictures at home, send in their pictures, and it does a very good job of simulating things. We do virtual consults, so it's all done, you know, over secure video. And a pre-op appointment can be done virtually, so people actually don't have to physically come here until the day of. Many people choose to come in the night before just to make sure, but some people do come in the day of, and then everything afterwards can be done virtually too. That's a big common part of my practice, anyways, is having our follow-ups virtual and all that. So the whole thing can be done without a person here. Sometimes we'll choose the implant size on the day of surgery. Sometimes we'll do it before with the 3D imaging. Just kind of depends on the quality of the 3D imaging. But again, if the experience wasn't just as good, and I thought that there was any sacrifice in terms of the process, we would have people come in before. But we don't need to because of the technologies and softwares that we have now.
Yeah. Well, thank you for that. Telemedicine's still scary to me a little bit, but I know it's got to get better. I'm starting to choose more just healthcare only online type things, even for the kids when it's little stuff, which has been amazing, like dermatology or like for Accutane and things like that. You just said something that I had a question about traveling. It was so good. Darn it, I lost it. But I'm really glad that that people are able to do that and turn around and go home so
Yeah.
quickly. Oh,
And
that's what I thought about it. Um, if someone is in the operating room having this done, do they have the ability to kind of change their size a tiny bit when they're in there, when they see it,
that's a
or
good question. So
yeah,
I will do that with a different surgery, with a implant exchange,
okay,
if that's being done awake, which can be
hmm
done too. If it's just a simple implant exchange, we'll. One of the things I love about it is involving a person in the process, and we do sizers, and we actually show them, set them up during surgery. Um, because of just the nature of kind of how it's done, we together, me and the patient, we've chosen the size. The patient has chosen the size before going in, and in most cases, that's the size we're going to go with. The only difference is in cases of asymmetry, where a person has one breast that's a lot different size than the other. We won't commit to the other side until I see things during surgery. That being said, during Preserve, it really isn't the best time to choose the size, because the only look you'll get is from the balloon. And the balloon is designed to create the space that the implant needs for the surgery, but it's not really a replicate for the implant. So, like, even probably the best
makes
way to see it is
sense.
when I inflate this, look at that, you know. So obviously that's not going to be what it looks like, but it's intentionally radially expanding the space. So it's
Uh,
all for very intentional reasons. But you're not going to be able to really look at things with the balloon and say, like, okay, that's what you probably look at things and be like, oh, it's a little
Panic.
weird. I don't know if I want to do this anymore. um, so it's just different. So that's why we commit to it before. But the 3D imaging we have is really good. It has a special module just for Preserve.
Oh wow,
And the people that really created the procedure worked with the 3D imaging software to make sure that it was as accurate as possible. It's not perfect, and I'll tell people what aspects I think it does a better job of than others, but I think it does a really good job overall.
that's so cool. Well, anyone who has gone to Amelia St. Louis and Bustmob has amazing things to say, not only about you, but your team and Dr. Tom, which is awesome. So thank
Yeah,
you guys for
that's
crafting
great.
that experience and giving up your busy time on a Friday. I know how crazy busy you are. So we are so grateful. And if anybody wants to watch these great stories, I love watching women be on the operating table being like, high five, this is amazing. Your Instagram has a ton of them, and TikTok. It's dr.fredman.amelia. Definitely go watch those because they're really cool.
Yeah,
Thank you.
thank you so much, and yeah, thank you, Bustmob, for all the support you give to each other, and every day it's wonderful.
It is a lot of fun. Well, thank you, Dr. Fredman. Have a
Thank you. You too. Take care. Bye.